All right, anatomy students. So here we are in the last and final chapter. We end with the reproductive system. Again, 100 slides, but I will go over them rather quickly and highlight the things you should focus on. Again, in general, you should know very well the anatomical structures of the male and female reproductive system. Those will obviously be possible test questions, especially labeling pictures of male and female reproductive systems. So the primary sex organs in the males and females are the testes and ovaries, and the accessory organs are the glands and all the external genitalia. We'll go over the males first. The testes are located within the scrotum, which is a skin and superficial fascia surrounding the testes, and its positioning outside of the body provides an environment 3 degrees cooler than body temperature, which is necessary for sperm production. You have a dartus and cremaster muscle responsible for wrinkling skin or elevating the testes. So here's a look at the reproductive organs of the male, a sagittal view. This is really common to look at the reproductive system in a sagittal view. So you can see here, so here are the testes covered in the epididymis. So sperm that are produced will then travel through the vas or ductus deferens, kind of up and behind the urinary bladder, and then through the ejaculatory duct, which is right here. The ejaculatory duct goes through the prostate gland and meets up with the urethra coming from the urinary bladder, and then sperm and urine both will exit out in the same way through the urethra. Here we have different glands: the bulbourethral gland, prostate gland, and seminal gland or vesicle all produce different fluid for the sperm to create a semen. And we'll go over some other things in a little bit too. So here's just another look. You can see the spermatic cord, which is how the testes will descend during embryological development. So sometimes male babies who are born, their testes don't descend all the way yet, which is a cause for concern. That can be fixed. So you can see here all the things that make up the spermatic cord, the different arteries, nerves, and veins that travel to the testes, as well as the vas or ductus deferens, which again is what the sperm will travel up to come out of the testes where it is being created. One other thing to note here is you see this superficial or inguinal ring. This is the end of the inguinal canal. So we have the testes descending through this inguinal canal, and that's what makes hernias a lot more common in males, because they kind of have this hole, in their lower pelvic region that intestines can easily kind of spill or be pushed out of. So the testes are an enclosed fibrous sac. The epididymis is the comma-shaped structure on the posterior testes. The tunica albuginea is the fibrous capsule, and it divides each testes in 250 to 300 lobules. And lobules contain about 1 to 4 coiled seminiferous tubules. So the seminiferous tubules are located inside the testes, and then the epididymis is kind of the common-shaped structure on top. So you can see this here, how the seminiferous tubules are located within the testes. This is where sperm will be produced, and then sperm will travel to the epididymis to mature. And when sperm are completely mature, they will travel up and out of the ductus vas deferens. So you have different arterial supplies to the testes of nerves and arteries. I'm going to pass over some of this. You have different microscopic anatomy. You have spermatogenic cells, which will produce sperm. You don't need to know specifically the formation of sperm. About 400 million sperm are formed per day, and this begins at puberty, and the process takes about 75 days. The big thing is that the forming of the sperm occurs in the seminiferous tubules. So the seminiferous tubules are what will create the sperm. And then the sperm will travel to the epididymis. There's about a 20-day journey for the sperm to move through the epididymis, and this is where they kind of mature and gain the ability to swim and to fertilize an egg. So again, sperm are formed in the seminiferous tubules in the testes, and then travel to the epididymis, where they wait until they're completely mature. So here's more histology, which I won't ask you too much information on. The ductus deferens will store and then transport the sperm. So you can see then Spermatic cord will contain different vessels, nerves, and the ductus deferens. And again, you can see those there. And this shows the inguinal canal at the left and an acquired inguinal hernia at the right. So this shows a part of the small intestine pushing through this inguinal canal. The urethra then carries sperm from the ejaculatory ducts to the outside. There's 3 parts of the male urethra depending on where it goes. So here are the 3 parts of the urethra, how it travels and carries both sperm and urine out. The accessory glands then, so the seminal gland lies on the posterior surface of the urinary bladder. It contains fluid to nourish the sperm. The prostate gland encircles the prostatic urethra. It sits right below the bladder, and it contains substances that enhance sperm motility and enzymes that clot and liquefy semen. And the bulbourethral glands also produce a mucus, which will enter the spongy urethra prior to ejaculation. Then we have the external anatomy of the penis, the shaft, the glans penis, and the prepuce. And I won't ask you guys too many questions about this, but you can see, again, the male reproductive structures you should know well and be able to label any sort of male reproductive picture. The male perineum, spermatogenesis. This is the process of creating sperm. It's divided into different stages, which again, I won't ask you too many specifics on, but this is how the transformation of a spermatid into actually a sperm that can swim and move about. So more about spermatogenesis. And again, I don't ask you too many questions about this. It is controlled by FSH, follicle stimulating hormone, and testosterone. And then the female reproductive system produces gametes or ova, which are the eggs, and it also prepares to support a developing embryo in the uterus. The uterus will undergo changes according to the menstrual cycle, which is the monthly cycle, as it affects all the female reproductive organs, which includes the ovaries, the uterine tubes, the uterus, and the vagina. So the ovaries, first of all, are small oval-shaped organs that produce the ova or the eggs. They're held in place by ligaments and mesenteries. There's ovarian arteries that supply the ovaries. We have the internal structure of the ovaries, which is shown here. The uterine tubes then receive the ovulated oocyte. The infundibulum is the distal end of the uterine tube, and this will be most often the site of fertilization between an egg and a sperm, and it's surrounded by fimbriae, which will help kind of carry or gather the egg into the uterine tube. The ampulla is the usual site of fertilization, and I'm sorry, I misspoke there. This is a test question. The ampulla is the usual site of fertilization, and then the isthmus is the medial third of the uterine tube. So here's a look at the different areas of the uterine tube and the uterus. The uterus, the biggest part of the uterus, is called the body. That might be a test question too. We have the ovaries surrounded by fimbriae, which are kind of like these finger-like structures, which help kind of gather the egg into the uterine tube. The infundibulum is the end next to the fimbriae and the ovary. The isthmus leads the uterine tube into the uterus, and the ampulla is the site of normal fertilization between an egg and a sperm, and it occurs in about this location of the uterine tube. You can see different suspensory ligaments, mesenteries that keep everything kind of held together. The vagina is also known as the birth canal, and you can see different layers of the uterus shown there. So the uterus lies anterior to the rectum and posterior to the bladder. It's usually anteverted or anteflexed, the usual position of the uterus. You have different parts of the uterus, the fundus, the cervix, which is the neck of the uterus. The cervix is shown in this area. This is the part that will dilate to 10 centimeters right before giving birth. So you can see kind of where the uterus is located in the cadaver. Here we have more areas of the uterus, how it's located right on top of the urinary bladder. So again, a growing embryo will push down on the bladder, causing females who are pregnant want to go to the bathroom. Here is the birth canal or the vagina. The cervix is this area. The uterus, I wanted to point out, so we have the infundibulum, which is the area next to the fimbriae. And then again, the ampulla is where the normal fertilization would occur. So supports of the uterus are shown here, the different mesenteries, ligaments. The uterine wall is composed of the perimetrium, myometrium, which has the smooth muscle layers that will contract during childbirth. And then the endometrium is the mucosal lining. So the uterine wall, the embryo will bury into the endometrium, and the endometrium has two layers, the functional layer and the basal layer. You have different arteries going to the uterine wall, which I won't ask you guys too many about the arterial supply. The vagina consists of 3 coats as well. Here's the external genitalia and female perineum. I'll let you guys read through this. I won't ask you guys too many questions about the external genitalia and perineum of the female, and you can read through those on your own. So here's the external genitalia, also known as the vulva of the female, and you can see here how everything sits. The pubic symphysis is actually the part that will soften and allow the pubic bones to separate, just to allow for more space for a baby to be delivered. Oogenesis in the female menstrual cycle takes many years to complete. You have primordial follicles arrested or stalled in meiosis 1 already in a female embryo. Luteinizing hormone can also cause primary oocytes to complete meiosis 1. Oogenesis always produces 1 egg and 3 polar bodies, and meiosis 2 is completed if a sperm penetration occurs. So we have the monthly menstrual cycle due to hormonal fluctuations in your ovaries and uterus, the ovarian cycle, which stimulates the production of ovarian follicles and oocytes, and then the uterine cycle, which prepares the uterine wall for implantation. The ovarian cycle has these 3 successive phases. The follicular phase is when 6 to 12 primordial follicles start to develop due to follicle stimulating hormone being released from the anterior pituitary. The follicular phase, we have more things going on. The ovulation occurs about halfway through, about day 14. This is when 1 mature egg exits from the ovary, and this is usually when there's a sudden increase in luteinizing hormone, and this is usually when fertilization can occur. And then the luteal phase occurs after ovulation in the last half of the ovarian cycle. The remaining follicle becomes the corpus luteum, and it acts to prepare for implantation of an embryo. And if it doesn't implant, the cordius luteum dies. All right, so here's the menstrual cycle, some structural and hormonal changes. Here we have hormonal changes, the fluctuation of the luteinizing hormone and follicle stimulating hormone around day 14. And the difference in the ovarian cycle shows the structural changes in the vesicular ovarian follicles and the layer of the uterine wall. Here's oogenesis and how eggs are produced through meiosis 1 and meiosis 2. I won't ask you guys too many questions about that. Here are levels of estrogen and progesterone. Levels of estrogen and progesterone will continue to be high if a pregnancy and implantation occurs, and otherwise they will fall away. Here are the 3 phases of the uterine cycle, and this shows the functional layer and the basal layer of the uterus. And the functional layer is what will get sloughed off during menstruation. And you can see that here, the functional layer greatly decreases its size during the menstrual flow. The uterine cycle then is the series of cyclic phases of the endometrium. It's directed by FSH and LH. It begins on day 1, the menstrual phase, where the functional layer is shed, functional layer then rebuilds, and then the secretory phase, it will prepare for implantation if it is a positive pregnancy. Breasts are modified sweat glands. They're underdeveloped in non-pregnant women, and milk production will start at or after childbirth. And I won't ask you guys too many questions about mammary glands, but they're filled with a lot of kind of fatty tissue and lymph tissue. So breast cancer can quickly spread to other parts of the body as well. So events leading to fertilization, the sperm will bind to the zona pellucida on an egg, and this undergoes what we called an acrosomal reaction, where it releases enzymes to form a slit. The fusion of the oocyte and sperm plasma membranes occurs. We have a cortical reaction, where enzymes will prevent any other sperm from binding. And then fertilization will actually be the chromosomes of the male and female gametes joining. So here we have the zygote, the chromosomes joining the polar bodies. So this would be the first kind of cell that's forming after fertilization occurs. Implantation, the blastocyst will then begin the implantation about 6 days after conception. It will eventually form a trophoblast. So the kind of these, we have an area of cells that continues to divide and divide. So here's the placenta formation, which will kind of form a sac around the baby to provide nutrients from the mother as the baby grows. And I'm going to skip over, I don't ask you guys a lot about this. The exchange across the placenta provides the fetus with nutrients and oxygen, disposes wastes, and allows hormonal signals to be sent to the mother. And I don't ask you guys too many questions about the exchanges across the placenta either. Childbirth then is also known as parturition. It occurs 266 days after fertilization, and labor are all the events that expel the infant from the uterus, as shown here. Reproductive system cancers in males. So testicular cancer affects about 1 in 50,000. It's cured in 95% of all cases. Prostate cancer is slower growing. Risk factors are a fatty diet or a genetic predisposition. Ovarian cancers arise from cells in the ovaries. Endometrial cancer arises from the endometrium layer. And cervical cancer is also slow growing, and it rises from epithelium at the tip of the cervix, and it's also often caused by the human papillomavirus, HPV, of which case a lot of young, or I would say 11, 12-year-old girls are now getting a vaccine against that, which is great. Breast cancer then is the second most common cause of cancer deaths in women. The treatment is usually surgical removal of the mass, which is called a lumpectomy, radiation therapy, administration of selective hormones, chemotherapy. And here are mammograms, which are incredibly important for detecting tumors in the breasts. And you can see kind of the difference there of the tissue between a normal breast and one with a tumor. Puberty then is a period of life between ages 10 to 15. The reproductive organs will grow to their adult size. The events of puberty occur in the same sequence in all individuals, but the age varies. Male secondary characteristics occur at puberty at about age 13. Facial hair, pubic hair, lengthening of the vocal cords, which deepens their voice. Their musculoskeletal system increases, sexual maturation, mature sperm will be in semen, and this is all due to testosterone production. Female secondary characteristics, the first menstruation, budding breasts. Other estrogen-induced secondary sex characteristics would be an increase in subcutaneous fat, the widening and lightening of the bones of the pelvic girdle, and the appearance of hair throughout the body. This is all again induced by different estrogen and progesterone in the females, which will also help with the growth spurt, usually from ages 12 to 17. Menopause then is the female reproductive peak. The female reproductive peak is in the late 20s, and then around age 35, the rate of follicle degeneration increases. And then ovulation and menstruation will cease at about 46 to 54, where the ovaries will stop secreting estrogen. The reproductive organs and breasts will begin to atrophy. And we will end our final chapter with that. Thanks for listening, guys, and I hope you guys are all doing well.